Pertussis is a disease that's caused by the bacterium Bordetella pertussis, and it spreads from one person to another from coughing and sneezing. When you get infected with pertussis, there is an incubation period of about a week, after which you just have a cold-like symptom with cough, running nose, and a slight fever. And after that, you get into a phase where you have bouts of coughing, and these bouts of coughing can be pretty severe, and it will last for about 10 weeks to perhaps 3 months, and that's the reason why pertussis is sometimes called the 100-day cough among the Chinese community. During these coughing spells, a lot of patients will be coughing and coughing and coughing, and they have no time to inspire, and they will sometimes inspire with a whoop, and this whoop sound is what makes the layman term of whooping cough. As the coughing progresses, it can cause complications in the patient, and these complications can range anything from infection in the lungs to even severe coughing causing fracture of the ribs, and they can also have infections spreading into the sinuses and the middle ear, and they can even have convulsions or fits. After the stage of severe paroxysmal coughing, the patient goes into a stage of convalescent where the cough gets less and less, and it's less frequent as well as less severe. However, although most patients will recover fully from pertussis, they can get complications during the stage of paroxysmal cough, and these complications are more severe in infants. Fortunately, there's a way of protecting ourselves and our children against pertussis. This is through immunization, and the pertussis vaccine is given in combination with a vaccine that protects against 2 other diseases, which are diphtheria and tetanus. So this vaccine, called the DTP, or diphtheria, tetanus and pertussis vaccine, is given to children at the age of 2 months, 3 months, and 5 months, and another booster is given at the age of 18 months. Despite this primary vaccination plus the booster, the immunity against the pertussis actually wanes with time, and by the time the child is about 10 years or so, the immunity against pertussis is already very low or not there at all. So all adults and adolescents beyond the age of 15 years should get a dose of Tdap vaccine. The current recommendation for Tdap is to be given as a single dose to adults. If we can give infants the primary dose of DTP and a single dose of Tdap for adults, this will prevent the transmission of pertussis disease within the population. And at the same time, adults will no longer be able to infect babies who are younger than 2 months before they get their first DTP vaccine. So please talk to your healthcare provider about the Tdap booster doses.